So honored to be continuing to tell the Sovah Health story. We're in Martinsville today, and I've got Dr. Bogle here with me. First of all, tell me a little bit about you, Dr. Bogle.
Hi, my name is Sukhdeep Bogle. I'm one of the intervention cardiologists at Sovah Health Martinsville. I have joined this hospital last year in August, so it's been 1 year, and so far journey has been wonderful.
You bet. Now, tell me what we're going to be doing today.
Yeah, today actually we're going to discuss about CMD, the condition or disease also known as coronary microvascular disease. And basically it's like we know about this disease for years, but we were never able to understand it very carefully, and actually we did not have the tools to diagnose it in the cath lab until recently. So now we have a CMD tool, what we call like core flow in our cath lab, and we are second hospital in Virginia to get this tool.
Did y'all hear that? The second hospital in Virginia.
Yeah.
That's pretty good.
Yes. Yeah. And we're gonna go, I'm gonna explain like about what patient needs to go for evaluation for CMD and how can they benefit from this evaluation.
Can we talk about this big machine over here?
Yeah.
Yeah.
So this is our cath lab, and this is the camera that takes the pictures when patient comes for a heart angiogram here.
Right.
So
you sit here,
Yeah.
are the feet here?
Yeah.
Yeah.
So patient sits here, and we usually go through the patient arm mostly when we do heart angiogram.
Okay.
And then this camera rotates over the patient and takes picture from different angles. So let me explain what CMD is. So CMD is the disease of the small vessels of the heart. So when a patient comes with chest pain and he gets an angiogram, we used to tell them there is no blockage. So your chest pain is like maybe some from other cause that we don't know about, or you may want to see another doctor, like a stomach doctor. But now, when the patient comes with chest pain, and it's this entity is more common in like middle and young age women, and as we know from in the past that these women always tend to present differently from men when they have chest pain. So what happens in this case, like you see the small tiny vessels, this is what we are assessing with that new tool. So what we get is like we get the resistance, and we also get the flow down that vessels with this special tool what we have in the cath lab now.
So you used to couldn't see it, could you?
Yeah.
Okay.
So we actually don't see those vessels.
Right.
So whenever these patients go to different emergency rooms, they have been to different hospitals, they have undergone stress tests, they have undergone echocardiogram, and they were always told like everything is fine, and there is, you may need to see the other doctor, or and what we know from past, like there is studies done on this disease that the prognosis is bad as compared to the patient who doesn't have this disease. But we never had the good tools to diagnose it. But now we can diagnose and give the patient diagnosis that this is what you have, and we can actually tell them if their pain is coming from the heart or is it not coming from the heart. So we have a recent study that is like core micra study, which is done on these patients, and half of the patients who were in the study, they were told that you have the disease, and first of all, we need to know like these patients didn't have the major blockage. So they have disease in the small vessels. So half of the patients were told that you have the disease and this is medication we're going to put you on and we will follow you up. And the other half, it was a blinded study, were told that, there is no major blockage. You may have this disease or you may not, we don't know about it. So we're not going to start you on medication, and you continue with your regular medication. So when we followed that patient in 6 and 12 months, we found that patients who were given diagnoses and who were started on medications, they had better pain perception, and they were able to follow up more regularly with their physicians, and they actually got the diagnosis, so they understood their disease better and they had better quality of life. So with this, tool, patient gets the diagnosis, and that is very instrumental for the patient diagnosis itself, because a lot of patients, has a lot of frustration, especially with chest pain, because they have been to so many different hospitals and so many tests has been done, but they never got the, actual diagnosis.
Gotcha.
Yeah.
Tell you what, I am so impressed with Sovah Health with all the new machines. I've seen the robot machines. I've seen all these things going on. I know we got a new emergency room in Danville, so it's so much going on here. And health is always improving by the month, isn't it?
Yeah. So this is like a special thing with which we can help our community, especially like women, because this entity is very common in women. And so when I was in training in Washington Hospital Center, that time in this technology just came in, and we diagnosed a lot of patients with this disease, and most of the patient had like a very good quality of care in terms of their follow-ups and their overall health, and they were happy that finally they got the diagnosis, which they have been wandering around for years.
Right.
So having this technique in our hospital, like we have already diagnosed few patients with this disease, and few of them were like coming to our ER for like frequently with chest pain,
Right.
but they never had the diagnosis, and they have like multiple stress tests. So so with this technology, our hospital is second one in Virginia, and then and we are able to like, we want to let our community know that if they have been having chest pains for years and they never got the diagnosis, they should talk to your primary provider. They should see their cardiologist, and they can actually send them somewhere where they can get the actual diagnosis. And patient is usually like, most of the time this is what patient wants to know before they start taking medications.
Absolutely.
Yeah.
Thank you so much for sharing that with us today. And of course, Sovah Health in Southside, I tell you what, take advantage of all these campuses because it's so much going on for improvement. I see it every time I come over here. So check out all the things going on at Sovah Health.